This is a video for the correct use of personal protective equipment for a ward with a safe corridor and all side rooms, called Scenario 1. Personal protective equipment should be put on before entering the room. Wash hands using the appropriate technique. This will be detailed on the soap dispenser and on posters around the ward. Don plastic apron. Snapping the neck loop in half enables the neck to be fully covered. Put on fluid-resistant surgical face mask. Ensure it is closely fitting and fully covers the nose and mouth. Position the upper straps on the crown of your head, above the ears, and the lower strap at the nape. Ensure mask is flat against the cheeks. With both hands, move the nose piece from the bridge of the nose firmly, pressing down both sides of the nose until you have a good facial fit. Place either face shield or goggles on to protect your eyes if high likelihood of blood or body fluid exposure, including respiratory secretions. This is strongly recommended if contact is to be made within 1 metre of the patient's face. Put on gloves. Please start removal of personal protective equipment within the isolation room. Remove gloves. Grasp the outside of glove with the opposite gloved hand. Peel off, hold the removed glove in the remaining gloved hand. Slide the fingers of the ungloved hand under the remaining glove at the wrist. Discard as clinical waste. Alcohol gel hands and repeat at every stage of the doffing process. Remove apron. Unfasten or break apron ties and pull away from the neck and shoulders, touching the inside of the apron only. Turn apron inside out, fold or roll into a bundle and discard. Alcohol gel hands before and after exiting the room. Remove goggles or face shield if worn. Outside of goggles or face shield are contaminated and should not be touched. This requires a clean assistant. To remove goggles or face shield, use both hands to handle the elastic straps or arms of goggles by pulling upwards, then over the head. Close your eyes as you pull. Place in a bin if single use, or hand to clean buddy who is wearing gloves and standing outside containment area to decontaminate them for reuse. Alcohol gel hands. Remove mask. Untie or break the bottom ties. Then untie or break the top ties and remove by handling the ties only. Discard as clinical waste by leaning forward slightly. Wash hands. If using own stethoscope, decontaminate it and clean hands again. Please ensure stethoscope is not placed around the neck whilst it is contaminated.